And we are back on the 0 Hour. This is Richard RJ Eskow, and as always nowadays, it seems, news events have directed the public's attention back to what I would describe as our ongoing crisis in healthcare coverage. And our next guest is uniquely qualified to discuss that. In fact, I even participated in a panel with her on that subject not too long ago. Carolyn McClanahan is a physician, a family practitioner who has made an interesting life change, I would say. She, based, I guess, on her medical experience, you can tell us more about that. She became a family finance planner with a focus, I believe, on medical issues. So she speaks nationally on issues of interest to both audiences, healthcare and financial. She wrote a recent piece in Forbes entitled "Politicians Need to Change the Conversation on How to Fix Healthcare," and that is a large part of what we will talk about today. So first of all, Carolyn, thank you for coming on the program.
No, it's a pleasure to be here. Thank you for having me.
And secondly, let me ask you this. Before we get into the topic of the day, just real briefly, you don't often hear about a physician making a life change like that. What inspired you to do that?
Well, it's very interesting. My husband and I, back in 2000, he had inherited a little bit of money from his parents that we had done well with, because everybody did well in the markets the late 90s. And we tried to find a financial planner, and they were all sales schmucks. And I went back to school for fun to learn about real financial planning, and I fell in love with it. I still loved medicine, and I actually still volunteered at a homeless shelter in a clinic for the working homeless, but I fell in love with financial planning, opened my own firm in 2004, and now I talk all over the country about the intersections of health and personal finance.
Yeah, there certainly are quite a few of them. In fact, my personal bias is I wish there weren't so many. I think it's a symptomatic, perhaps, or in fact, not perhaps, in my opinion, symptomatic of a broken system that that we are in this bind. But let's talk about that system a little bit, because, I've sort of made my position on healthcare clear. I have a background in healthcare administration, finance, and economics before I went to just having opinions for a living. And I feel, after a lot of experience in the insurance world, that we really need to go for Medicare for all. But you have a different approach that is interesting and definitely worthy of discussion. And you mind telling us a little bit about it?
Well, the background on this started is because I work in a community health center, and when the debate around healthcare reform started, well, it's been a debate forever, really, if you think about it, but especially before the initial election of President Obama, I was trying to figure out what are ways that we can make healthcare more efficient. And from my background in finance, I realized that insurance, the way we use it in this country, doesn't follow the rule of insurance. Insurance is supposed to only cover catastrophic or very expensive and rare events. And we basically use insurance as a reimbursement scheme. Unfortunately, the insurance companies, they get paid a premium for that of about 25% just for paying our bills for primary care, when primary care is not insurable. And, community health centers, they can provide primary care, mental health care, and dental care, and they already do this for under $1,000 per person per year. And I thought, why don't we strip primary care out of insurance coverage, provide it directly for free, and then that will return insurance to the true definition of insurance. The nice thing about this is that you could go with the rest of insurance, then you can go Medicare for all, or you can go private system, or you can go, my preference actually is a public and private system, kind of what the ACA was supposed to be, private insurance with a true public option for them to have to compete against.
Well, okay, and let's just talk for a second about what you describe as true insurance, because I think it's worth just dwelling on that for a second. When we think about car insurance, for example, we think about the fact that 99.9% of the time, we don't need it, right? But
Right.
but an insurable event means an accident, a theft,
Right.
those rare but costly events that take place. That's what we traditionally think of as insurance. And if you know the history of health insurance in the country, as you do, but not all
Mhm.
members of our audience will, you know that, for example, hospital insurance, the early Blue Cross
Yeah.
was really, that was the insurable event people were going after. And then the primary and physician piece of it came in later. So what you're really saying, as I understand it, Carolyn McClanahan, is you're saying let insurance companies handle, whether they're public or private,
Or
handle,
Medicare for all.
or Medicare for all, which is public, um, let them handle those insurable events, that is, that costly but more intermittent, whereas primary care, which is something that everybody should use at least once a year, I would say, at a minimum, primary care can be provided at a very affordable rate. So your idea is basically, if I understand it, public primary care provided through community centers, community health centers, and
Mhm.
then insurance companies, if they want to go in and compete on the secondary and tertiary care, they can do that. But really, the health care that people use most regularly, which is less insurable because it's more common, that gets delivered through community centers. Have I got it right?
Well, close, because a couple points I want to make that are very important. First off, 75% of the population really only needs primary care. They don't need specialty care. Most people don't have high cost, expensive problems. And the lack of a good primary care system in this country is why we are so unhealthy. I mean, we pay 3 times the average OECD country for our health care, and we're actually unhealthier than most of those countries. And so by giving primary care away for free to everybody, well, people get mad when I use the word free, taxpayer funded to everybody, it would cost us about $300 billion a year, but we would save so much money through one, Medicare, Medicaid, the armed services. They would not have to pay for primary care anymore. We would be able to quit the DSH payments to hospitals. There's so many different cost savings that we'll get out of it. Plus, by stripping primary care from insurance, then that's going to immediately reduce the cost of insurance, which is a big problem for a lot of people. Finally, Spain did this in the 1980s. They created community health centers within 15 minutes of everybody. That would be difficult here because our country is so much bigger and we have a lot of remote areas. But with technology now, we can do some incredible things. We can borrow stuff like from Africa. They use community health workers. With telemedicine now, you could have community health workers everywhere that can just go to people and bring the doctor to the people through like telehealth. So there's so many innovative things that we could do with this and do it very effectively and inexpensively. This would put, and one of the things I think is so important is this would take the burden off for so many people that just can't afford basics like getting a sore throat covered or their hypertension, diabetes. There's so many easy things we can take care of through this system.
I do think it's a really interesting idea. And as a Medicare for All guy, here's my suspicion that if we did that, you see, I used to work in the insurance world, and here's a secret I learned about insurance companies. They actually don't want to be in the insurance business. They want to be in the sure thing business. And so, they might actually say, well, okay, we're going to go do other things now. Because a lot of the people that do need, that 30% that needs more than just primary care in any given year, they're not going to want to cover them. So, but whatever would happen, I do think it's a really interesting idea. I'm certainly a big believer in the community health model. I think the other piece of it that interests me a lot is, back in my days working in that world, I did a lot with technology and data analysis and so on using primary care to spot problems early, to really, get to know the whole person, get to know what's going wrong, how a primary care physician plus good data can be used to direct people to the right kinds of treatment at the right time. And as a result, I was unpopular with cardiac surgeons, for example, but I did speak to the American Academy of Family Practice, which you are a member of, several times. There was a lot of interest there in how, and this was many years ago, on how family practice physicians can use data to be better caregivers and gatekeepers for their patients' care. Is that part of what you envision also?
Well, yeah, I mean, there are other parts of this that we really need to address is, the electronic medical record system has sapped the joy out of care for almost every doctor in every specialty, especially primary care though. And the fee-for-service billing system that we have it's not set up for good patient care. And so you would be able to remove the fee-for-service billing from the primary care system, which is great, but also we could create a nationalized electronic medical record that's built around patient care instead of the current ones that are built around billing. And so doctors can actually use them to tell the patient's story and do great patient care. And from that, we could do great studies and to really understand what's going on with population health. There's so many robust things that could be done through a very well-funded community health center system.
Well, back in the day, I actually had dreams of helping design a patient-centered health record and even creating a protocol so that everybody followed the same, every vendor or whatever followed the same, fields were interchangeable and exchangeable, and if you moved from one place to another, it meant the same thing, but that, I'm for all of the above. Before we go, Dr. McClanahan, I do want to ask you about, there was a recent story saying that Amazon, JP Morgan Chase, and Berkshire Hathaway wanted to get together or are getting together to try to address employee health care issues, and leaving aside, maybe my personal opinions of two of those three corporations. What do you think of I've been around long enough that I've seen all sorts of efforts by employer coalitions of one kind or another to address the healthcare problem, and so far none of them has really made a huge difference that I can tell. What do you think of that idea?
Yeah, you're exactly right. They're talking first about self-funding. I mean, and other large companies have tried self-funding before. What they do bring to the table is a lot of possible technology, which I think, I always try to look, what is the good that can come out of this and what is the bad? The good that'll come out of it is they'll do some innovative things. Certainly that we can take and hopefully use with a broader audience in the country. The bad that'll come out of it is, I do think, and from what I've read, because they have released very few details, but what I've read is really they're going to put the onus on the patient still to have to decide on care. And one thing I read in the New York Times actually was that a patient would be able to go onto the website and click the problem they're having to find the best doctor for their problem. That is so wrong, because medicine is not that cookie cutter. And patients, when your elbow hurts, it might not be your elbow, it might be your heart. And so patients don't know that. And that's why, to me, I hope they don't make a move towards people trying to, pick specialty care and again have 5 different doctors where nobody knows what the other's doing. So if they do something, I do hope it has a good primary care focus to it. Will it be available for the broader audience? I mean, they're talking about just employer-based coverage again, which is a big mistake we made back when, President Eisenhower gave employers tax breaks for health coverage. And now we've been tied to employer-based coverage since. I think we need to divorce from that concept. Large companies can do it, but most of our population is employed by small companies. I have a small company, and I'd prefer not to be in the healthcare or health insurance business for my employees. We need to do something better.
Yeah, I think the idea that we're going to revolutionize healthcare by making people smart shoppers has got to go. As I always say, it's not a supply and demand issue, because the physician is the one who's informed. So in effect, the physician, who's might be the supplier, also helps shape the demand by telling people what's wrong with them. It's not like buying a movie, getting it, watching a Netflix show or something.
Right.
Um,
Right.
Unfortunately, we're going to have to leave it there. But Carolyn McClanahan, very interesting idea and very interesting thoughts. Thanks for coming up with them, and thanks for coming on the program to discuss them.
My pleasure. Thank you for having me.
Absolutely. And we will be right back after this. I am Richard RJ Eskow, and this is the Zero Hour.